governor's budget proposal again calls for a municipal service fee that is projected to generate about $136 million to cover state police agency staffing and operation cost. Unlike that from the prior flat fee proposal, this proposal reportedly is predicated on station coverage costs based on incidence and coverage area and considers other factors like population and income. As you probably already know, it's been fairly public, the formula, and each municipality is able to figure out, what they believe their chargeback would be. I represent 28 municipalities, and there is great disparity, vast and varied, between what each of them would be charged. It is hard to explain when you are neighboring municipalities why one is being charged several hundred thousand and one is being charged 15,000. There are certain things we can explain, but that is just a very large disparity. So there's great concern about how they're going to be able to meet the chargeback and how they're going to pay for it. So my question is the governor proposing any changes to current statute to allow municipalities to generate the funds necessary to pay for the cost of the Pennsylvania State Police chargeback?
Not that I'm aware of.
Okay. So what tools, I guess, currently exist in statute that you're aware of, which would allow them to generate the necessary funds to pay the chargeback?
Local municipalities manage their own budgets and determine how to pay for those budgets. I wanted just to correct you on, or clarify on what the criteria is. It isn't based on incidents. I just want to clarify that it is based on state police coverage, municipality population, income level, whether they're full, part-time, or full-time or part-time. So I just wanted to clarify that.
So, and I still get that, but I mean, there's still a great disparity between what some are being charged and some are, and they're neighboring. So it's causing a little bit of panic. It's also causing them to pay more attention as to what are the state police providing to us. And they're actually marking it and tracking it now. And the other thing they want to know is if we are required to pay for it, will we be getting services like our local ordinances enforced? Will there be more state police? Will they be able to respond more timely? And the answer to all of those in the hearings were no.
Yeah, I mean, this is to maintain the police force that we have now, given that we have a reduction in dollars coming from the motor license fund. So without this fee or without this income, we have concerns that we won't be able to have the necessary number of cadet classes.
And I understand that. I just think they need a more dedicated, more constant flow of funding. So I just want to change course real quick before we're out of time. Community health choices. Representative Topper earlier asked if the appropriation request was adequate. I think this is the third time in this hearing that we'll be asking this question, but the budget document shows not a single new senior from now until the end of June 2021 in community health choices. So that's exactly in the budget document, 362,373 seniors from now until June of 2021. I'm a little confused because we're already asking for supplements this year. When Secretary Miller was here, she said that is the fastest growing population in PA, yet from now until June of 2021, we are saying there are 373 seniors. That's it. I don't understand how that makes sense. How are we not asking for more money or not budgeting for more money?
Yeah, I'll have to look into the details of that model and see why there's not, or what's driving that static population there, and get back to you.
So, I mean, just because I think, I believe this is the second year we've asked for a supplemental, people are asking questions back home, and I don't know if that makes us look very responsible when we know it's a fast-growing population. We know we have the silver tsunami. I think it's already started, not even upon us anymore. It's already started. Yeah. So I need to understand. So we are expecting no growth from now until June of 2021 in community health choices.
I'm gonna have to look into it on why they're showing that population there.
So, I mean, my request is that we look at that carefully because the public isn't crazy about us asking for supplements when we already know the data is going to require that. So I would just ask that we take another look at that and make sure we are being responsible to the taxpayers, to that community that needs the service, and that we're able to provide what we need.